Imagine being fully conscious as a surgeon saws through your leg. You can feel every cut, every scrape of bone, every stitch. Your screams echo through a packed amphitheatre where medical students lean forward, fascinated by your agony. This wasn't medieval torture. This was medicine in the Victorian era. Welcome to Nightmare Narratives, where true history bleeds into horror and the strangest legends might just be real. If you like the eerie, the unexplained, and the downright disturbing, hit like and don't forget to subscribe. Some stories are too dark to forget. Today, we're diving into one of medicine's darkest chapters, when the best intentions led to unimaginable suffering, and progress came at the cost of countless lives. The Victorian era, 1837 to 1901, was a time of incredible progress: steam engines, telegraphs, photography. But step into a Victorian operating theatre, and you'd find yourself in what can only be described as a chamber of horrors. Surgery happened in amphitheatres packed with spectators, medical students, curious gentlemen. Even the general public could buy tickets to watch operations like they were attending a play. Except the screaming was real, and the endings were often tragic. The numbers tell the story. Nearly half of all amputations ended in death. Abdominal surgery? 9 out of 10 patients died. These weren't rare complications, they were expected outcomes. Meet Robert Liston, known as the fastest knife in the West End. In an era without anesthesia, speed was everything. Liston could amputate a leg in under 3 minutes, a skill that saved lives simply by reducing the time patients spent in agony. But speed came with a price. Liston once moved so quickly that he accidentally cut off his assistant's fingers along with the patient's leg. Both patient and assistant died of infection. A spectator, thinking he'd been slashed by the flying blade, died of shock. It's the only surgery in history with a 300% mortality rate. Surgeons were judged not by their precision, but by their speed and their ability to ignore screaming patients. They developed what we'd now recognise as severe psychological trauma. Many turned to alcohol or opium to cope with the horrors they inflicted daily. Their tools were crude: saws, knives, and hooks that looked more like torture devices than medical instruments, and they used the same tools on patient after patient, sometimes without even wiping off the blood. For patients, surgery was literally a fate worse than death. Many chose to die rather than undergo an operation. Those who did face the knife had to be held down by multiple assistants, while they screamed themselves hoarse. Contemporary accounts describe patients biting through leather straps, breaking their own teeth from clenching their jaws, and some actually dying from the shock and pain before the surgery was complete. The only anesthesia available was alcohol or opium, barely enough to dull the edge of agony. Some surgeons would knock patients unconscious with a blow to the head, trading brain damage for temporary unconsciousness. But surviving the surgery was just the beginning. Post-operative care was almost non-existent. Patients were packed into overcrowded, unventilated wards where infection spread like wildfire. The smell of gangrene and death was so common that hospitals became synonymous with dying. In 1847, Hungarian Dr. Ignaz Semmelweis made a shocking discovery. He noticed that maternity wards run by doctors had death rates 5 times higher than those run by midwives. His conclusion: doctors were carrying something deadly on their hands. Semmelweis mandated hand washing with chlorinated lime water. Death rates plummeted immediately. You'd think the medical establishment would celebrate this breakthrough. Instead, they rejected and ridiculed him. The idea that gentlemen's hands could be unclean was insulting to their pride. Semmelweis was eventually committed to an asylum where he died, ironically from an infection. It took another 20 years before Joseph Lister began using carbolic acid as an antiseptic. Even then, many surgeons refused to adopt his methods, preferring their blood-caked coats as badges of honour. The Victorian era was also the age of medical experimentation, often with horrifying results. Doctors tried everything from electrical shock therapy to ice baths, frequently using the poor and mentally ill as unwilling subjects. Brain surgery meant drilling holes in skulls with hand-cranked drills, often while patients were awake. Treatments for mental illness included spinning patients in chairs until they lost consciousness, or submerging them in ice water for hours. The demand for anatomical knowledge led to the grisly trade of body snatching. Resurrection men would dig up fresh graves to sell corpses to medical schools. The infamous Burke and Hare murders in Edinburgh showed how far some would go. They skipped the grave robbing and went straight to murder, killing 16 people to sell their bodies. The poor suffered the most. Workhouse hospitals became testing grounds for experimental procedures. Patients had no right to refuse treatment and no legal recourse when experiments went wrong. Everything changed on October 16, 1846, at Massachusetts General Hospital. Dentist William Morton successfully demonstrated the use of ether as an anesthetic during surgery. For the first time in human history, major surgery could be performed without pain. The news spread rapidly across the Atlantic. By 1847, ether and chloroform were being used in British hospitals. Suddenly, surgeons could take their time, operate with precision, and explore previously impossible procedures. But anesthesia alone wasn't enough. It wasn't until antiseptic techniques became widely adopted in the 1870s that mortality rates truly plummeted. The combination of pain-free surgery and sterile conditions finally made surgery more likely to help than harm. The Victorian era also produced heroes of medical reform. Florence Nightingale revolutionised hospital sanitation during the Crimean War, reducing death rates from 42% to 2% simply through cleanliness and organisation. Today's sterile operating rooms, with their bright lights and precise instruments, exist because of the horrors of Victorian surgery. Every protocol we follow, every safety measure we take, was written in the blood of those early patients. Modern medical education emphasises ethics, patient consent, and evidence-based practice, all responses to the brutal experimentation of the Victorian era. The Hippocratic Oaths, first, do no harm, gained new meaning after decades of well-intentioned torture. Patients today have rights that Victorian patients couldn't imagine: the right to refuse treatment, the right to informed consent, the right to pain management. These weren't given freely. They were hard-won through centuries of medical abuse. Every medical breakthrough now goes through rigorous ethical review, partly because we learned what happens when doctors have unlimited freedom to experiment on human subjects. The Victorian era reminds us that progress isn't always pretty. For every medical breakthrough we celebrate, there were countless patients who suffered and died to make it possible. Their agony wasn't meaningless. It taught us that good intentions aren't enough. Medicine requires not just knowledge and skill, but compassion, humility, and respect for human dignity. The next time you undergo a painless procedure in a sterile hospital room, remember the Victorian patients who screamed so that you wouldn't have to. Their suffering built the foundation of modern medicine, and their memory demands we never forget how precious and fragile medical ethics truly are. What aspect of Victorian medicine shocked you the most? Let me know in the comments below, and don't forget to subscribe for more dark chapters from medical history.